Many thanks for joining us here on News State of our first story now. And head of the European Union delegation in Ghana, Ambassador William Hanna, is warning of the urgent need for African leaders to create job opportunities and develop the agriculture sector to help prevent illegal migration into Europe. William Hanna says the lack of prospects in the West African sub-region is to blame for the phenomenon. He was speaking at the meeting on the implementation of a 5-action plan in Accra aimed at addressing the root causes of migration.
Economic Community of West African states and European leaders met in Valletta, the capital of Malta, in November last year and agreed on a political declaration and common action plan to manage migration flow. The Accra meeting with the International Center for Migration Policy and Development and ECOWAS was to map out concrete actions expected to be implemented by the end of 2016. In an interview with Joy News, the head of the European Union delegation in Ghana, Ambassador William Hanna, charged West African leaders to create job opportunities in the sub-region to help prevent the phenomenon of illegal migration.
It's more urgent than ever before to give an alternative. And I think if there were alternatives in these parts of Ghana, then the young people would take them. But it's the lack of prospects for the future which is leading some of them to take the risk. Others realize the risks they're facing, but some are prepared to take them. And what they face as they go across the Sahara, the stories that people tell of that is appalling. It's not an easy option. It's a dreadful option. And even if they get through, then they may be faced death in the Mediterranean. So it's something which we need to provide information about, but we also need to work on alternatives, job opportunities for the future.
Representative of the International Center for Migration Policy Development, Emerintia Erasmus, said the group will ensure that concrete initiatives to move the action plan forward are adopted.
We hope that this meeting, which is gathering the ECOWAS member states, the ECOWAS Commission and other partners and international organizations, will help to develop possible initiatives which can be used to maximize the development impact of migration.
Elements of the action plan are designed to address the root causes of migration, launch projects linking relief to the vulnerable in the sub-region, facilitate responsible private investment in agriculture, as well as double the number of scholarships for students in West Africa, among others.
Let's turn our attention to health now. The National Health Insurance Authority says it is working hard to settle debts owed the various health facilities who have been complaining of indebtedness by the authority. Seloma Dono is Communications Director of the NHIA.
In 2015, they haven't received their claims amounting to millions or huge sums. I am unable to get the right figure, but the Superintendent Medical Officer, Dr. N.S. Anderson, tells me that it's been very challenging.
Yes, 90 million appears like a lot of money, but from what we do, I wouldn't say it's not a lot of money, but the hard fact is that we make payments of about 3 million cedis every single day, or we incur about 3 million cedis every day. So if you put that in context, then you can see where 90 million cedis places. So it means that in a month, we incur or pay about 90 million cedis. So you can put that in context. So the last time we made payments was in respect of May or so. But I'm aware that some payments are being processed and some payments are either going to the providers or will go to the providers by close of this week. So, it's kind of, it's taking quite some time, but we think that we'll be able to surmount the difficulty we're having currently and close the gap. But you mentioned the fact that the 19 million is up to December 2016. Now, as I'm speaking to you right now, there are providers who haven't been submitted their claims for December 2016. So it's quite difficult having, a total figure like that. I'm not disputing that figure, but what it means is that service providers do not submit their claims sometimes on time. So, for example, there is some convention or some agreement between the NHI and the service providers that when you submit your claim, we'll give you like 30 days to submit your claim, and it will take us 60 days to vet the claim, after which we will start making payments. So that's about 3 months, 30 plus 60, that gives you 90 days, which is about 3 months. So if you take out 3 months from the number of months, we are supposed to be owing, you now get the real amount of money or the real number of months we owe. I'm not disputing anything. I'm just trying to explain to you how the process is. So, the discussion is put in its proper context. So, just about 40% of the people submit their claim, about 1 month after service delivery, and we are just in the second month of the year, so you can understand what that means. So we have operational constraints. We have sometimes constraints coming from the service providers, and sometimes we have constraints which are quite external to our operations. So we're trying to do our best in the midst of the circumstances to alleviate some of the difficulties the providers are going through. I must admit, and indeed I'll be one of the first to admit that the providers have kept faith with us, and we seriously empathize with the situation they find themselves in. That's why we're working around the clock to ensure that things get better.
Sure. But Salom, do you appreciate that some health facilities across the country are also complaining they will not accept patients with the NHIS card because you owe them?
Well, that hasn't come to my notice as I speak. The service providers normally work under umbrella groups. Usually the private providers work under the Society of Private Medical and Dental Practitioners. The government facilities work under the Ghana Health Service, and the mission or faith-based facilities work under CHARGE. And as I speak to you, I've not really heard anything from any of these umbrella bodies. I'm not saying that should happen, but we are in talks with them. We keep engaging them to make them understand what the situation is and what steps we are taking to ensure. Do
you have money, NHIA? Is there money? Do you have money?
We are a beneficiary of government resources. So as and when money is made available, we have money. But as I'm telling you right now, we have some money and we are making or processing or preparing to make some payments. So we believe that in the next few days or in the next couple of days, some payments will be made.
There were some checks at some health facilities across the country suggest a strain on healthcare delivery across many parts of the country.
This morning, I went to the Wa Regional Hospital, now the Upper West Regional Hospital, and we are talking about 19 million Ghana cedis owed to health facilities in the Upper West region. And out of this, over 19 million Ghana cedis that we are talking about, close to 4 million of that amount is for the Upper West Regional Hospital. And the Upper West Regional Hospital serves as a municipal hospital, at the same time served as a regional referral center for clients in the region. And so what's really happening is that the hospital, according to authorities, are unable to buy medicine and non-medicine consumables for the hospital. Here's the case: they have to have the money, go to the regional medical stores, and then procure some of these medicines and non-medicine consumers there. And they are not able. And then according to the medical superintendent of the hospital, Dr. William Dodu, he told me that they are also unable to pay their casual workers at the hospital. They are also unable to buy several things at the hospital, and because of that, if care is not taken, the hospital will grant a halt. We are really not even surprised that Nodoli Hospital is now being referred to as the health maker of the Upper West region, because the Nodoli and other hospitals in the region are supposed to gravitate towards the Upper West Regional Hospital. But here's the case, it's now the opposite. So people are now moving from the regional hospital to the other district hospital for healthcare delivery, which is not good. I also bumped into one guy, his name is Muslim Idrisu, and he told me that the past week he had his father there, and then also a friend, and it cost him 1,000 Ghana cedis. And then because he has to buy this medicine and medicine consumables outside the hospital, and then he thinks that if the health insurance, if the money was paid to the health facility, he wouldn't have paid that much. And so here at the regional hospital, the drugs are not there, the medicines are not there, and so you have to buy the drugs outside.
So, and I presume this has affected a number of persons who usually come to this particular health facility to seek treatment, right?
Yeah, that's what I'm telling you. That
exactly.
Like I told you, that I spoke to several people who are there, and the only medicine that they could give you at this facility maybe is paracetamol, and also the other lesser cost drugs. Just a week ago, I was at the hospital, and we took a patient there, and then medicines like Buscopan, you couldn't get them at the hospital. Any medicine that sometimes that is above 20 or 30 Ghana cedis, you can't get it at the hospital. And so it's really worrying here, right?
Okay,
Rafiq. Taking your patients to the hospital means that you have more into your pocket in order to save life at the hospital here.
So that was Upper West Regional Correspondent Rafiq Salam bringing us an update on the situation in that particular region. But my colleague Nana Joy Intu has also been doing some checks in the Western region and our reports.
Well, I'm told that since May 2015, they haven't received their claims amounting to millions or huge sums. I am unable to get the right figure. But the Superintendent Medical Officer, Dr. N.S. Anderson, tells me that it's been very challenging since June. They find it very difficult even paying their temporary staff that they have engaged to help them in running the day-to-day activities of the hospital. Suppliers that they owe, very few of them now do supply them because they kind of have some kind of faith in the system that definitely they will be given what is due them. But most of the suppliers feel reluctant to even supply to them because they also claim that their monies are locked up and it's difficult for them to get extra money or get money to go for a new stock of drugs and all other things to supply them. So he says that it's been very challenging since May 2015. They are finding one or two things or one or two ways of helping them run the hospital effectively, but it's not been very smooth for them at all.
You're watching News Today here on your Joy News channel on Multi TV. We're taking a break. We'll return shortly with some more news. Don't go away. Many thanks for staying with us here on News Today. Now, the National Association of Graduate Teachers says the non-payment of salaries to its members is tarnishing the image of the association. General Secretary of the association, Stanislaus Nabole, says about 15,000 teachers are yet to receive their salaries from the Controller and Accountant General 3 years after they were employed. According to Mr. Nabole, efforts made by him and the association on several occasions to get the matter resolved has proven futile. He's been speaking to Joy News' Mama View Usoboaji on the AM show.
Well, we know of some teachers that have not been paid salaries. Some have been on the job for a year, some 2, and others even 3 years. But they weren't paid because of a government policy not to pay salary arrears beyond 3 months. So this thing led to a strike in 2013, a strike within strike in 2014, and even in October 2015, the teacher unions nearly went on strike with it as one of the concerns. But as we speak, some of the teachers are not paid, and they are getting very much agitated.
And they are very much unhappy even with the mother associations.
Precisely so. They appear to think that the mother associations are not doing enough for them. But then we've made every effort. We have gone to the Minister of Employment over these concerns. We've been to the National Labour Commission. A roadmap has been drawn for the payment of such outstanding salary arrears. By the roadmap, 30th June 2015 should have been the last date for the payments. But as we speak, so many teachers are not paid. I have written to the Minister of Employment and Labour Relations in September last year, asking that the ministry should do something about it. In October, when we threatened strike, we sat down with Fair Wages and Salaries Commission, we sat down with the Minister of Employment, so many stakeholders. As part of the roadmap to solve the problem, the Controller and Accountant General was instructed to give us a list of the number of teachers that applied for these salaries. Then another list of those that they have paid. A third list of those validated for payment. And a fourth list of teachers who have not been validated to be paid and why. The Controller and Accountant General has not responded to that. I wrote a reminder. The day before yesterday, I sent another letter complaining, but nobody is listening. Nobody is talking.
Do they acknowledge receipt of your letters, though?
They will not acknowledge receipt of the letter and will not act on it.
So I take it that you are equally as frustrated as those teachers who have not been paid.
We are even more frustrated because the teacher loses the salary. But for us, we lose an image. We lose a credibility. So our matter is serious because we depend on the confidence and the trust of the teachers we lead. So the moment they start having doubts about our ability to lead and solve their problems, it gives us difficulties.
Let me just say that, you know, it's not only NAGRATs. They're unhappy with NAT, CCT, TEWO, in fact, all the mother associations. So how many teachers are we talking about, these unpaid teachers?
That is precisely what we wanted to know by asking for the list of those not paid. But somebody is holding on to it and deifying that information in a way that we cannot explain. They don't want to tell you how many teachers have you paid, how many are left to be paid. Nobody wants to talk. But we can estimate that at least we have more than 15,000 teachers not paid.
More than 15,000 teachers not paid, and some as far back as 3 years ago.
Yes.
So what do we do? I mean, what do you intend doing as NAGRATs? Are you meeting with the other associations so that you speak with one voice and take one action?
Yeah, we've been working together. And within this week, the teacher unions will hold a meeting. Between today, Wednesday, and Friday, there will be a meeting. And then this salary arrears will be one of the issues. Now, after that meeting, you will know what the next step will be.
Is this normal salaries that everybody's supposed to be paid at the end of the month? Or these are maybe increments, arrears, or things like that?
Normal salaries. A teacher is employed with an employment letter, and the teacher has gone to the classroom and taught, and he's not been paid
for 3 years?
No.
So how are they surviving?
Exactly.
And what are they imparting in the children? Because if you go to school hungry, then what are you teaching our children?
See, we have a problem. We have a state that professes to be involved in quality education. Then we are building schools all over the place. We are buying exercise books. But the teacher that should lead the children to learn, you don't pay it. Basic salary, this is criminal. Somebody is employed, the person has worked. Another person should pay. And you don't pay. But supposing the teacher had not gone to class, you would have seen what would happen.
But are these teachers going to the classroom?
Yes. You have to continue going to the classroom in the hope that you will be paid someday.
But, you know, I think I'm a bit surprised that NAGRAT, NATS, and TEWO, if they were directly involved, they would have solved this, don't you think?
We have been directly involved. We have been directly involved. The Fair Wages and Salaries Commission is involved. The GS is involved. The Ministry of Education is involved. Labor Commission has been drawn into all this. We don't know what is happening. Somebody must tell us.
So what can we do? I mean, you meet and talk, but the reality is, what can we do? After all, your letters have not been duly acknowledged, no response.
We will meet on Friday. And when we meet on Friday, we will come out with what to do next.
In the meantime, the teachers are not happy with the associations.
We understand. But then what else can we do? We must act within the limits of the law.
Should they continue to go to the classroom and teach?
We can't advise otherwise. Because if we say they shouldn't go to a classroom to teach, we are making their case worse. For now, they should go to a classroom and teach until we come out with a collective decision.
Do you know about the quality of teaching they're giving to the students?
Of course, I can only guess that they are not giving out their best. And that is, everybody should know. Every first-year student in education will know this.
Still on education, and the University Teachers Association of Ghana, UTAG, is calling on government to lift an embargo on public sector employment to enable universities across the country employ more staff. Now, the teachers say the inability of universities to employ the needed staff is affecting its ability to fully carry out its mandate. Now, addressing the news conference today, the association indicated the universities are, for instance, unable to run new programs because they do not have enough lecturers to take up those programs. Now, here are excerpts of that press conference.
The workload of the lecturer is so much that people are just dying. They are falling sick out of pressure. Again, it's difficult now to develop new programs, because when you develop the program, you need experts to teach. And so if you cannot employ people to teach, it means that these new programs cannot be rolled out. Even the older ones, some of them are not being run because you don't have the personnel to run them. So all we are saying is that it puts us in a very tight corner. Meanwhile, we have the student numbers the same. And those of our colleagues who have retired, who have resigned, who are dead or who are incapacitated are not being replaced. So the workload is left on the few that are in the system.
If government does not heed them, where do your students stand?
Our students, I believe, would realize that the demands that we are making are in their interests. And we believe that when it gets to them also sacrificing or making their voice heard, they will support us in this action.
So what action are you planning on taking?
Oh, well, I mean, as I said, legal action, and we don't want to preempt any other action. We just believe that they will understand. But as we move on, we'll be rolling out actions that we think are appropriate at the time. But for now, we will not preempt any action.
What's your fear with government taking the internally generated funds?
The universities will come crumbling down. The universities will just turn into primary schools or whatever, and we cannot compete on the world stage as universities in Ghana.
You say the universities will crumple down if government should take the internally generated funds. What do you mean by that?
What I mean is that they will have no authority. Every university must have an authority to do what they want to do. They need autonomy. They need independence. And that is enshrined in the acts that establish the various universities. There's no university anywhere that can survive if it has no autonomy, if it has no control over the activities that it does. And Ghana cannot afford to be left out of the world stage of university education. Thank you.
Now, the murder case of Ibaka North Member of Parliament has been transferred to the National Headquarters Unit of the Ghana Police Service. Now, the regional unit of the force made the announcement after earlier calling for a press conference to update journalists on the progress of investigations. Joining us is Raymond Akwa, was at the Regional Police Command earlier today, and is joining me now in studio with a lot more on what really happened there. So, Raymond, quite an interesting side, really. We're all thinking we're going to be told something, and then this just comes out of the blue.
It was spur of the moment decision by the regional command. You could see that they were all set, everything from microphones to the table, their conference room, the small one they use. We were even told to go and gather and wait on the regional commander to come and give us that all-important press briefing, because he had indicated early on that it was going to be daily, so every other day. Yesterday they did, today they're supposed to do, then subsequent days they will be doing so. But the PRO then came in and said, bad news. We are handing over this particular, what they call, case to the national headquarters, so we cannot say anything further on the issue. We asked questions as to why now? When was the decision taken? She was not willing to answer that. She said that she has limitations as to what information she can give out there, but so far as she is aware, that is all that she can say. The reasons she was not in the position to do. I personally even confronted the regional commander, Dr. Dampare, and asked, really, what would occasion such a change in the plan, since you've had some success, if it's anything to go by? You arrested some people in the first place, so you are on the right trajectory. So how come in the course of this particular case, when you seem to now be interrogating the first set of people you've arrested, you are handing over the case? He was unwilling to speak, but said that, I mean, they as a command is handing it over. then the question comes in, at what point did the command decide to hand over the case? If they took the decision on their own. So that is what he was unwilling to answer. So most of what happens was a standstill, journalists seeking information on the reasons why they are transferring the case, but with none forthcoming from the officials involved. In fact, our contacts also at the CID headquarters, where we understand will be the final destination of this particular case, says that they are yet to receive any indication they'll be getting the case, but they'll be willing to work on it. I mean, in all fairness...
So that means they haven't even been communicated to,
that
as far
is
as this
the
case
indication we are getting from their end. But it says, in all fairness, it's standard practice. If any region, any department across the country feels is unable to deal with the case for one reason or the other, they have to actually ask them to take over this particular case. There are also related developments on this particular issue. We understand that, there were some reports that more than 5 have been arrested and some additional ones.
We're told there were 6 or so.
Yes, but the police command at the regional level says, as of this morning, they are arrested still the same 5 they had yesterday. They were interrogating them. There's an indication that maybe around 4 of these may actually be given the opportunity to go home.
Okay.
But they are
preparing. They may get bail.
Yes, they are preparing to let them actually go home if they finish with the processes, and they then give them the bail they need. 4, excluding the driver of the late MP. So that's what we know to be the latest on this particular issue.
Okay, Raymond, many thanks for that update. And that was my colleague Raymond Akwa. He was at the Greater Accra Regional Police Command earlier this morning, and he's brought us a lot more updates on that particular murder case of the Ibaka North Member of Parliament. You're still watching News Today here on your Joy News channel on Multi TV. Time now for some business after these messages.
And it's now time for business. And the Finance Minister, Seth Terkper, has announced estimates outlined in this year's budget and indicated he would be presenting a supplementary budget to Parliament in the coming month. At a press conference to outline some strategies government is implementing to turn around the economy, Seth Terkper underscored the essence of further funding commercial projects that have the ability to pay for themselves.
We know debt has been, of concern, so if we spend some time on our debt management strategy, the reduction in the deficit, as we saw, is one of our strategies for controlling the debt, because the deficit, when financed, is what goes into treasury bills. We may all like the high treasury bill rate, but that is the direct result of government borrowing and increases the domestic debt. We have also adopted various debt management strategies. You know some of them, we've been talking about them. That when we borrow for commercial projects, the project should pay for the loan. It shouldn't be the taxpayer who should pay for the loan. So we are placing a lot of our commercial projects, on public debt. Off public debt and into a self-financing mechanism, which is leading to the on-lending and escrow, mechanism that, we are putting in place. During question time, we can discuss some of these policies, but we have mentioned them, in previous times. So if we sustain the deficit and we sustain the other debt management policies and depend on the pipeline, disbursements, as well as, the pipeline projects. My colleagues has been, hearing me a lot talking about focus on pipeline projects. We don't have to borrow for new projects all the time. As you all know, there are roads, hospitals, schools, and others, including some by the statutory funds, which we need to complete. And in just focusing on using disbursements of existing debt, and the budget resources to complete them, we can continue, and that's what we are doing. Continue with investments, as we have outlined here, without and still putting a cap. And then as the on-lending begins to pay back, it also means that, that it's not just the taxpayer who has to be paying. And this is where the restructuring of the energy SOEs, become, very important.
And importers are kicking against the excise tax stamp policy scheduled to be introduced on the 7th of March this year. The policy would require manufacturers and importers of products attracting excise duties, the like of tobacco and alcoholic beverages, stick stamps on their items. This is to ensure tax compliance, and stakeholders have already been engaged on the implementation, but the Importers and Exporters Association is raising issues against it. Here is Executive Secretary Samson Asaki.
The policy is to be implemented from the 7th of March, will be preceded with port demonstrations and trials from the 1st of March. The products in question include tobacco, alcoholic beverages, among others, which attract excise duties as an indirect means of discouraging their patronage due to reasons like their health implications. The producers are to buy the stamps from the Ghana Revenue Authority, which would then be able to better ascertain how much duties is expected to be paid by any particular company. The goods of importers would also be subjected to the affixing process on each item before the goods leave the ports. A stakeholders meeting towards the successful implementation of the policy was held in the latter parts of December last year. It emerged the long-awaited contract for the public-private partnership operations at the ports has been signed, paving the way for the affixing machinery to be installed at the ports. The Food and Drugs Authority and the Ghana Standards Authority are also said to have given their approval for beverage manufacturers to affix their stamps on the crown of their bottles for now, while a better alternative is worked on for the near future.
That's it for business on Joy News Desk. But for more, you can join me here on the marketplace at exactly 1 for more. My name is John Kojo-Amwako. Stay.
Thanks for staying with us here on News Today. Now, President John Dramani Mahama's new Interior Minister designate, Prosper Douglas Barney, is expected to be vetted by Parliament's Appointments Committee today. He's expected to answer questions on the readiness of the police to ensure impartial discharge of their duties before, during and after the elections, as well as other key security questions. Now, the former Chief of Staff is among a set of ministers nominated recently by the President to serve in his government, but their suitability for the job is to be determined by the Appointments Committee of Parliament. Let's go live now to Parliament and speak to correspondent Elton Brobe, who's standing by with a lot more. So, Elton, we understand that the President's nominee for the Central Region as a minister, I'm speaking of Kweku Ricketts-Hagan, is currently being vetted. So what has come out of his vetting so far?
Well, he's mentioned the fact that the Cape Coast region is regarded as the fourth poorest in the country. So if his nomination is approved by Parliament, among the things that he will be doing to address this issue of poverty will be to lead the crusade for the establishment of more factories and also the revamping of existing ones so that jobs could be created for the inhabitants of the region. Secondly, you also look at improving tourism infrastructure in the region because the region abounds in tourism infrastructure. But according to him, access to accessible roads to these sites have become a major concern. So he will look at improving some of this infrastructure to ensure that the region will become the preferred destination for tourism. He's also spoken about education infrastructure because the region, as you all know, abounds in many of the high-profile secondary education in the country. Unfortunately, according to him, inhabitants of the region have always been denied access to some of these educational facilities. He wants to ensure that people graduating from the junior high school to the senior high school are at their very best. For that reason, he wants to improve education in the region and look at how best people in the region can have access to some of these secondary schools. He also went on to, talk about the fishing community and reiterated his commitment, indeed, that of government to ensure that there's a pension scheme for the fisher folks. So these are some of the things that he's been talking about before the Appointments Committee of Parliament.
I see. And prior to this particular day, a lot of people had been speaking of the President's nominee for Interior Ministry. I'm speaking of the former Chief of Staff, Douglas Barney. Has he already been to the place? Is the vetting process for his particular designation, has that already started?
Not yet. Okay. George Ricketts-Hagan, the committee started with him and he's still before the committee. Okay. As most of us, 3 persons have been penciled to appear before the committee, and that includes the Deputy Minister Designate, Professor Barney. Once Wicked Hagan is done, the expectation is that he will be called, but that is at the discretion of the chairman of the committee.
Okay, all right. Elton, many thanks for your time on news today, and that was parliamentary correspondent Elton Bobby bringing us a lot more from that particular meeting there in Parliament. Now, away from that, then, 2 persons have allegedly been shot by police at the Mampong Midwifery Training School. A teacher and his brother were allegedly shot by police in Mampong after they were mistaken for robbers. Let's get more on this now from correspondent Ohime Interior, who's live in Mampong now and is joining us with a lot more. So, Ohime, what's the situation in Mampong as we speak?
Yes, it's a very sad moment for students and teachers of the Mampong Midwifery Training College. As we speak now, I'm on the campus now. I've been trying to get a word from the school authorities, but I'm told the principal is in a meeting. But I had the opportunity to speak to a brother of the lead deceased person, Francis Bear, who is a deceased now, age 33. He is a tutor, and his brother Timothy Ubene, 28. And I'm told at about 2:30 a.m. this morning, they had a distress call from a female teacher who called for assistance because armed robbers had broken into her residence. So on the way to assist the teacher on a motorbike, that is where the 2 people were shot by the police officers who, at that time, had also received a similar call to come to the aid of this female teacher. So when news of the demise of the 2 people went through the Mampong Township, the whole community gathered at the Mampong Government Hospital to confirm the story for themselves, where the bodies of the 2 are being kept now. So I would say that the whole community has been thrown into mourning. You see people in pockets discussing this incident of the teacher's demise, who I'm told is a very free man, is a breadwinner for many of his people who are from the north, especially schooling at the Mampong Midwifery Training College.
We'll leave here for now. Ohime Interior, many thanks for that particular update from Mampong, where we are told that a teacher of the Mampong Midwifery Training School there has been shot and killed by police who claim that that particular incident happened mistakenly. They mistook him for a robber. Still watching News Today here on your Joy News channel. Time now for some international news after this break. And that's how we wrap up on News Today here on the Joy News channel on Multi TV. Remember, there's a lot more news when you visit myjoyonline.com. My name is Kwabna Chenchen Nibuati. Many thanks for your company.